Okay, so this one right here is called the Gluteus Maximus. I don't know, maybe you guys have heard of this before. It's the most superficial muscle and the largest of all. And some general information about it. So if we can get to look at it first. So this is it. As a muscle right here, it originates from the fascia of the Gluteus Medius, the external surface of the ilium, behind the posterior gluteal line, okay, and the fascia of the erector spinae, the dorsal surface of the sacrum, right here, lateral margin of the coccyx, and the sacrotuberal ligament, okay, and the insertion of this muscle is the upper fibers, the posterior part of the iliotibial tract, and the fascia latae muscles. The lower fibers of this muscle, they insert into the gluteal tuberosity of the proximal femur. Okay. And so the gluteal tuberosity is found somewhere here. So it originates basically from this region and inserts onto here. And so the action for you guys is listed here. Extension of the femur from the flexed position in the hip joint, lateral stabilization of the hip and knee joint, external rotation of the femur. And the nerve supplied is innervated by the inferior gluteal nerve. Okay, so some basic movements of this muscle is basically here, and the rotation movement of this muscle is basically shown here. All right, and so we're gonna move on to the next one. So we can hide this, and this is the Gluteus Medius. If we isolate it, we can see that it has close relation to the posterior, the lateral aspect, sorry, of the hip bone and the greater trochanter of the femur. And so the origin of this muscle is for the external surface of the ilium between the anterior and posterior gluteal lines. Okay. And the insertion is on the lateral surface of the greater trochanter of the femur. The action is the adduction of the hip and stabilization of the pelvis. The anterior part of it causes flexion and internal rotation, and the posterior part causes extension and external rotation and is innervated by the superior gluteal nerve. And so you can see the movements right here. It causes abduction, so it moves the lower limb away from the body, and the medial rotation of the hip occurs like that. Okay. That's for the Gluteus Medius. And then finally, we're going to go towards the Gluteus Minimus of this kind. So we're going to hide this. And we see the Gluteus Minimus. We isolate it. You can see here that it originates from the exterior surface of the ilium between the anterior and inferior gluteal lines. Okay. And so the insertion is on the greater trochanter again of the femur. Okay, that's the Gluteus Medius Minimus. The action: abduction of the hip, stabilization of the pelvis, anterior part flexion and insertion, internal rotation, and posterior part extension and external rotation. And it's also innervated by the superior gluteal nerve. And so the movements that we can see from here is basically the abduction of the hip, okay, and the medial rotation of the hip. Right. And if we hide this, now we can look at, before going into the deeper muscles, we can see that this part right here is called the tensor fasciae lata. And if we isolate that, this is it. And so the origin is from the anterior superior iliac spine and the anterior part of the iliac crest. The insertion is on the iliotibial tract. Okay. The action: it tenses the fascia lata, abduction, flexion, and internal rotation of the hip joint. Nerve supplies the superior gluteal nerve as well. So if we have a video, you can see what this can do right here. Causes also flexion of the hip. It also causes medial rotation of the hip. All right. Now, just gonna hide this and then go to the deeper muscles in this region. We can see here that this is called the piriformis, and then we're gonna isolate this one, and we can see and take a deeper look at where it starts and where it ends. So the origin is the pelvic surface of the sacrum. There, you guys can see where it originates right here. Just looking at this part, originates from here. Insertion is on the superior border of the greater trochanter of the femur. The action is external rotation, abduction and extension of the hip joint, stabilization of the hip. Nerve supply is direct branch from the sacral plexus and ventral rami. So the motion right here is the lateral rotation of the hip. Okay. So if we go there, I'm going to hide this. Now we're left with those smaller muscles. First, I'm going to dive into this to clear it. This is the obturator internus. If we isolate this, we can see where it originates and inserts. So that's the obturator internus. It originates on the inner surface of the obturator membrane and the margin of the obturator foramen. So it will cover mainly, you can see this whole thing. We can't see it because it's covered by that. Obturator comes from the obturator foramen, so obturator internus is this one, and it inserts on the medial surface of the greater trochanter above the trochanteric fossa. Okay, right there. Action, external rotation, abduction, extension of the hip, nerve supply, obturator internus nerve. And this is the movement that it does cause lateral rotation. Next, we're gonna stop the isolation. We're gonna hide it. Now, there's the obturator externus, I think. No, where is it? Somewhere here. Just give me a second. Maybe it's 1 second. Let's check. There's an obturator externus somewhere. No. Okay, let's just go into this first. So these ones right here, the superior gamulus, ischial spine is the origin. Insertion is the medial surface of the greater trochanter with the obturator internus. Action, lateral rotation of the thigh, abduction and extension of the hip. Nerve supply, obturator internus nerve. And lateral rotation of the hip as well. Okay. Stop the isolation. We can hide this. This one right here is the inferior gamulus. And it has basically very similar things, but originates from the ischial tuberosity, inserts on the medial surface of the greater trochanter with the obturator internus tendon. Action, lateral rotation of the thigh, abduction and extension of the hip joint. Nerve supply, quadratus femoris nerve. Okay. Stop the isolation, hide. This muscle right here is called the quadratus femoris. If we isolate this one, we get to see the origin from the lateral border of the ischial tuberosity, inserts on the quadrate line below the intertrochanteric crest of the femur. Action, external rotation, abduction of the hip joint. Nerve supply, quadratus femoris nerve. And this also causes lateral rotation of the hip. Okay, and so we stop the isolation, we go hide it. This is the one I was talking about, the obturator and externus, and you cover the isolate, and you can see that it covers, instead of the internal part, the external part of the obturator foramen. And so it originates from the outer surface of the obturator foramen, superior and inferior pubic rami. Okay, and inserts on the trochanteric fossa of the femur. Action, adduction and external rotation at the hip joint, stabilizes pelvis in sagittal plane, nerve supply, obturator nerve. And so the motions that it causes is the lateral rotation of the hip. Okay. And so these are the muscles of the gluteal region. Okay, so this is the end of this video. I hope you guys have enjoyed this one. I hope it's useful for all of you, and I will see you guys in the next one.